Now with a report on breast augmentation, here's our reporter, Laura Windsor.
For women who desire a change from their present breast implants or are just considering breast augmentation, the newest silicone implants are very safe and have a more natural feel and appearance. Dr. Robert Brueck of Associates in Cosmetic Surgery tells us how he advises women about these decisions to enhance their appearance.
Most of the implants I do for augmentation are between the ages of like 20 and 40. The implant exchanges are older women. Maybe a woman had implants put up in Milwaukee, they retired down here, they're 50, 55 now, and she's had them in for 20 years, she wants them bigger, they're too hard, whatever. You do an exchange. And so you see the whole gamut.
Dr. Brueck compares silicone versus saline implants.
Basically, when a woman comes in for an implant exchange, primary augmentation, she has a choice between two implants, saline and silicone. For a long time, all we could offer women was saline because the FDA took silicone off the market. So now we're seeing more and more women coming in for an exchange from saline to silicone. And I personally prefer silicone. I've done hundreds of breast augs over the years, and I think it's a far superior product. I think it's softer, it's more natural, it's more forgiving. And women, by and large, love silicone versus saline. The only real advantage that, in my opinion, saline has is that if a woman has some asymmetry, a saline implant you can inflate. So you can put an extra 5 cc's, 20 cc's. You can't do that with silicone. In other words, you can't put a needle in the silicone implant and put in 20 cc's of silicone. Saline you can. But do I think that's a problem? No. Most silicone implants are coming in 25 cc increment. So you have a 300 cc implant, a 325, a 350. And I say to people, we might put a 300 in one, a 325. There may still be a little discrepancy, but it goes back to what I tell all my patients. In 32 years, having done hundreds, I've never met a woman who hits perfectly symmetrical breasts. And you're not going to be one of those. So I make sure people understand that. But silicone is far superior. Do you know what's great about implants, doing breast augmentation, and that relates to silicone, is that that operation has now overtaken liposuction as the #1 cosmetic procedure. And I think one of the reasons it has such a high satisfaction rate, 95+%. In 32 years of doing breast augmentations, and again, I've done hundreds, I've never had one patient ever come in and regret having it done. It is the one thing that more women come in and say, I want to feel good about myself and how I look in clothes and how I feel. It goes back to our self-image. And of course, for men, like I said, it's hair. For women, it's the bust line. And you want to have a nice bust line. And I think one of the reasons I do a lot of augs is I want the breast to meet the woman's body shape. In other words, when you see her post-op, it's not like, oh, nice breast job. You know, it's like, boy, she's got a cute figure. I wonder. That's the perfect response. Cute figure, nice shape, looks good in a bikini, looks good, you know. And that's the kind of look that I try to give all my patients.
Breast augmentation is a highly personal matter. You should undertake it only to fulfill your specific personal goals, only after a thorough, thoughtful consultation with your surgeon. I'm Laura Windsor for the American Health Journal.
For more information about Dr. Brueck or Associates in Cosmetic Surgery in Fort Myers, call 1-888-287-9033 or you can visit beautybybrueck.com.